Break. It appears health experts are starting to get better in training in breastfeeding. Yeah. Dr. Lindsay Moore joins us, a longtime friend from Indy Moms blog and IU Health. This is your topic. I mean, we've discussed before, but it surprised me. First board certification exam in breastfeeding. We're talking 4 doctors.
4 doctors, board certification, so it's an actual legitimized medical specialty with a board certification you can obtain, just like I have a board certification in pediatrics.
And so for the nursing mother, at what point do we reach out to the doctor? Because as we're about to see, there are other resources out there.
There's a ton of them, absolutely, and it can be confusing because, especially with doctors not having done this for so long, we kind of abandon the field. Honestly, it's never too early, especially if a mom is going around and maybe had troubles last time. Always reach out when you're pregnant. It's better for us to guide a plan and get you to the right resources than wait till it all heads downhill and gets complicated more than it needs to.
With a new certification, it's quite possible that, for instance, your doctor may not either be certified or even quite yet know who the right person to turn to is.
Absolutely. I haven't taken my test yet. I will be hopefully in the spring in like the second group of people trialing it out. But really, anytime a doctor tells you they really are interested in breastfeeding medicine, it's probably someone who knows a decent amount. But then you can also kind of reach out and start looking for this certification. It'll take time to catch up, but in the next 5 years, I think we'll start seeing it more and more. And yeah, if you know you've had trouble before, or if you're working with like a lactation consultant who are often fabulous at what they do. I cannot treat all the breasts out there. I love them. If it's not getting better quickly or responding like they hoped it would, that's when I would at least reach out to someone who does this at a higher level of a physician type of care to say, okay, what can you do for me? Again, I see way too many people who come in 8 weeks later and it has all gotten more complicated and spiraled down the drain. And I'm like, ooh, if only.
Intervention
and then I constantly hear, why didn't someone tell me earlier? And I'm like, I don't know.
Let's talk about resources that are in place and do good work. The La Leche League.
La Leche League is a fabulous free resource with a lot of peer and also some trained helpers. Same as USA Breastfeeding. They have another kind of similar but different resource, and they're fabulous. A lot of mom-to-mom support, as well as trained people who can help them plug into more care when they need it.
Isn't it interesting? You said mom-to-mom support, because there are some areas in the medical industry where I know a doctor would probably say, you know what, let's pretty much keep it in the trained silo. But in this case, it is very, and sometimes it's just a support. Other times it's like, that happened to me too.
Absolutely. Just knowing you're not alone. Moms are very isolated, and postpartum, we've talked about that before. You get very isolated in our culture of not really being allowed to look for help, to complain, or to brag about what you've done and be happy. This is a space for those options.
Indy Lactation Care is another resource.
Yeah, they're a private lactation consultant group, and they do home visits as well. And I've shared some patients with them, and they do a fabulous job. Absolutely.
Dr. Lindsay Moore, we'll let you go so you can go study.
Absolutely.
For your certification.
That's right, I know.
When are you taking the test?
Sometime in the spring. They haven't announced the dates yet, so it's coming up.
We'll talk to you before then. But
all right.
if I don't get the chance, good luck on that.
Thank you.